Hello and good morning, everyone. So today we are from Let's 2024 Group 22. So here we're gonna do our group discussion video 9, where we're gonna talk about the our topic that we choose before this, which is the COVID-19. So actually we have come up with four things. But before I elaborate more on the topics, so let us introduce ourselves first. So my name is Muhammad Hanif bin Raza and my matrix number is 198797. So how about you, Chiu?
Thank you, Hanif. My name is Chiu Kwang Yung, metric number 199398. And now I pass to Africa.
Hi, my name is Nur Afika binti Abu Safyan and my metric number is 199077. Next, I'll pass to Fatin Nadira.
Hi, thank you, Afika. My name is Nur Fatin Nadira binti Muhammad Zaitun and my metric number is 198904. Next, I'll pass to Aiman Fitri.
Thank you, Fatin Lida. So my name is Aiman Fitri bin Shahrom and my metric number is 198590. So I'll pass to Nur Ain.
Hello everyone, my name is Nur Ain binti Ahmad Izzat and my matric number is 198401. Next will be Fatin Atika.
Okay, thank you, Ain. So, hi, my name is Nur Fatin Atika binti Muhammad Rashidi and my metric number is 199036. So, lastly, Fitri.
Okay, my name is Fitri Nordiana binti Mak Suhaimi and my metric number is 198524. So I'll pass to Hanif back.
Okay, thank you everyone. So like I said just now, we're gonna elaborate more on the subtopic, which is our topic is COVID-19. So actually we have come up with four things, which is the first one is the current issue, second is symptom, the third one is how to handle, and the fourth is prevention. So I think we're gonna start with the current issue first. So how about that? Is that okay with you guys?
Yes.
Okay.
Okay, for actually for the current issue, I'm thinking of like before this, during our first MCO, the cases of day actually around like 300 per case, 300 cases per day. But now like I just saw the trend, the what we call the slope is very steep. Like it suddenly increased up to 1,000, 2,000 cases per day. So I actually that's why we choose this topic, just to make sure that people aware about this kind of things happen nowadays, so that they know that the cases is not actually going down, but then it's going up like truly a lot. So that's my point about the current issue, which is in our in our topic, which is the COVID-19. So is there anyone want to add more on the current issue?
Thank you, Hanif. Maybe I will continue for this part. Yeah, it's about current issue also. For beside the COVID-19 is the current issue, and another one it become the current issue as well. Like we need to take care our cleanliness and the hygiene for ourselves. Yeah. Before this, maybe I will share about the definition of the cleanliness. Okay, cleanliness is both the abstract state of being clean and free from germ, dirt, trash, or waste, and the habit of achieving, maintaining that state cleanness is often achieved through cleaning. Okay, the cleanness maybe until now or today, due to the COVID-19 pandemic, now we will really know the step like wash the hand in the correct step, and then we go out maybe need bring along the alcohol and mask, and go back home we need to take bath first before we contact with our family member. Yeah, so the cleanness is important for now. Okay, there is my sharing. Anyone with to proceed? For next subtopic, maybe who may can start their sharing. thank you.
I think how about we jump to the symptom of COVID-19 because I think it's a quite good subtopic. So
Yes, I
anyone
agree.
with the symptom topic?
I'm going to talk about the symptom. Can I
Okay.
proceed?
Sure, of course.
Yes.
All right, thank you. So COVID-19 is a respiratory condition caused by coronavirus. Some people are infected but don't notice any symptom. Most of people we have mild symptom and get better on their own, but about 1 in 6 will have severe problems such as breathing. The odds of more serious symptoms are higher if you are older or have another health condition like diabetes and heart disease. So, the emergency symptom of COVID-19 is like trouble breathing, constant pain or pressure in your chest, flushed lips or face, and suddenly confusion. So if you guys have these emergency symptoms, so you need to call a doctor or hospital right away if you will have one or more these symptoms. That's all from me. Anyone want to proceed with the symptom?
I think I continue for the symptom. As we guys know, symptoms like Fatin Nadira has said before, serious symptom that occur only if we have some serious diseases such as heart disease or diabetes and serious diseases like that. So I think I will talk about the most common symptoms that that shown by the affected people and the less common symptom. So the most common symptom that are showed by the affected people are like fever, dry cough or tiredness. This likely is the most, as we know, if we have fever, our parents will ask us to go to hospital and go for the swab test, all of that. So for the less common symptom, or like we can say it's like rare symptom, is sore throat, diarrhea, conjunctivitis, headache, or rash on skin. So I think for the most common symptom and less common symptom, like Fatin Naira said, the infected people will develop mild and the illness can be recovered without hospitalization. But if we get some serious symptoms, we must and should go to the hospital immediately. So I think that's from me.
Can I add one more point?
Yes, you may.
Yes.
Okay, people keep thinking how long does it take for symptom of the coronavirus disease to appear. It was like on average it takes like 5 until 6 days from someone is infected with the virus for a symptom to show. However, it takes up to 14 days. That's all from me.
Okay, thank you, Fatin. I think we can proceed with our third subtopic, which is the how to handle. How about that?
Okay, so can I proceed with that subtopic?
Yes, you may.
Yes.
Okay, so this subtopic will focus on how to handle the COVID-19 if you have contracted the symptoms or you have close contacts with anyone that have the similar symptoms. So the first thing first that you really wanted to do if you have close contacts with people that have COVID-19 is firstly you need to monitor any kind of symptoms that you might have. So the symptoms have already been explained clearly by Ayman Fitri and also Fatina Dira. Thank you for that. So if you notice any noticeable symptoms of COVID-19, you need to right away call KKM or your nearby clinic kesihatan to schedule your swab test appointment. And you know, the reason why you need to contact the KKM or your nearest nearby clinic kesihatan is to inform them any possible new clusters, I guess, to spreading more. And for the second one, yeah, I think that would be all for me. So Afika, can you proceed?
Okay, can I add some points? Okay, firstly, if you are diagnosed with COVID-19, like Fatin Atika just said, someone from health department will call you and you have to answer the call to slow the spreadness of COVID-19. It is very important for you to answer the call so that your family or your close contact will be alert to do the swab test, and this will reduce the spreadness of COVID-19. And the things that you must do is, first, you have to separate yourself from other people. You have to stay at home. You have to stay at home, and then if possible, you stay in a specific room and away from your family. And the second one, you have to also, if possible, use a separate bathroom when you are at home, so that you will the risk to spread between your family also reduce. And then use separate belongings such as plate, cup, spoon, and the towel, and also for all your belongings you have to use separately. And then the second one, you have to cover your coughs and sneezes when you go out and wear the mask. First, when you cough, you have to cover your mouth and your nose with a tissue, and then the tissue that you have used, you have to throw it. You have to throw it away in a trash can, and then immediately you have to wash your hands with water and soap. Or is there is no water around you, you can use hand sanitizer. So I think that's all from me.
Yeah, thank you, Afika. So I think we can go to our last topic, which is the prevention. How about that? Ain, can you start the prevention?
Alright, okay. So in this part, me and Fitri will talk about prevention to COVID-19. So this is the source from World Health Organization. So yeah, for the first prevention would be, you must always clean your hands often. Use soap and water or an alcohol-based hand rub, or easy to say, hand sanitizer. So at least the hand sanitizer should be 70% of alcohol, based on what I've heard before. And use soap and water, since you cannot just wash your hands, like use water, it doesn't make any change, it doesn't change anything. Okay, so next would be maintain a safe distance from anyone who is coughing and sneezing. Well, for me, I think if you have this coughing and sneezing symptoms, you should stay at home and don't go outside, since it's the first prevention to stop the spreading of COVID-19. You don't know what will happen, so just stay at home and let other people in your or other family members to go outside and buy stuffs or anything possible. For the third point would be wear a mask when physical distancing is not possible. For example, you're in crowded places, you should wear a mask, or you don't go to that crowded places at all. because there is a huge possibility you will get COVID-19 due to the crowds and all. And I would like to point out that physical distancing between two people will be around 1 meter. So Fitri will continue for the next point.
Okay. For the prevention, we must avoid 3C, which is close, crowded, and involve close contact. So the risk of getting COVID-19 is higher in crowded and inadequately ventilated spaces where infected people spend long time period together in close proximity. So we try our best to go out when we really need to go out. Secondly, open a window so we will increase the amount of natural ventilation when indoors. I think that's all from me.
Okay, thank you everyone. So I think we can choose the most suitable subtopic that we want to include in our PSA video too. How about that? Shall we discuss about it?
Yeah, of course. Sure.
Yes.
Yes.
Actually, yes, Aiman,
you go first. You go first.
You go first, Aiman. You can go.
Okay. I think I will choose the prevention topic for our PSA video because we see that every day in the media like Twitter, Facebook, YouTube, and television always show the ads or advertisement for the prevention of the COVID-19, but still there are a lot of people that could not do it and spread the coronavirus even up to 3,000 cases a day. So I think we should create awareness and help the government to fight corona.
I do agree with Aiman because it is important to put awareness on the prevention.
Okay. I think I also agree with Aiman. Like the prevention to me is more like the highlight of this what we call the in our topic. This is the highlight that we want to to spread awareness to among the people. So is there anyone that add something?
I think I would say that how to handle COVID-19 is also can also be a part of the PSA video. Rather than this preventing it, we should educate people on how to handle it. So yeah.
That's also a very good point. I think we can include two subtopic in our video. Is that okay or can
Yes, I think it's okay.
I don't know.
But I think with only one subtopic, we can just compact our video. Two is like we have only two until 3 minutes. So I think if we include two subtopic, there will be a lot of things to be highlight.
So I think
maybe we can just choose one subtopic.
I think I'm agree with Ain Good's point. How to educate people about how to handle the coronavirus. But I also think that prevention is better than cure. So how about that?
Yeah, I do agree with Aiman. I will go for the prevention as well. Yeah, it's like prevention better than cure.
Okay, so since that is a problem, so I think we just focus on prevention. But then if we don't have enough points or something like the video was too short for the prevention only, so we just add how to handle.
Yes, I agree.
I agree with Ain. Totally agree.
Okay, I think we can come to the conclusion right now, right? Or
yes, sure.
Okay, so in conclusion of our to the discussion. Actually, we have come up with 4 subtopics, which is the current issue, symptoms, how to handle, and also the prevention. And for the subtopic that we want to include in our PSA video 2 is the prevention of the COVID-19. I think that's all from us. Thank you.
Thank you.
Thank you, everyone. Bye.
Thank you.